Hi, I'm Dr. John Alchemy with RateFast, and I'm here today to help you understand a new concept we have developed at RateFast. It's called the Functional Loss Rating. Now, when many people think of impairment rating, they think of whole person impairment, and that is the way that impairment ratings are created and the way that they're processed. But what they don't understand is that the AMA guides have actually outlined an interplay of three very important concepts within the four corners of the AMA guides. They are as follows. The whole person impairment. Most of us relate to that. If you're in the workers' compensation space, you're very familiar with the term. Second is the activities of daily living. On page 4, table 1-2, there are 34 activities of daily living, and they actually control the impairment rating in the AMA guides. Number 3, pain and symptoms. And that is also something that feeds into the activities of daily living and also into the whole person impairment. Why do I bring this up? Because the common misconception is that activities of daily living actually are used to create the whole person impairment rating. And while they do create the whole person impairment rating, they are the actual focus of the AMA guides. But the convention and the currency of the AMA guides is the whole person impairment. And that's something very important. If you can understand this concept, you will understand the functional loss rating and why we have created it and why it is a better and faster method, in my opinion, for estimating functional loss and a better whole person impairment for the workers' compensation system. So let's break that down a little bit. In the AMA guides, the whole person impairment is actually there to make an estimate of the activities of daily living loss. And then if you turn over to chapter 18, that's where you can actually find the connection between activities of daily living and pain and symptoms. So there's actually a very intimate relationship between pain, symptoms, activities of daily living, and then the product, which is whole person impairment. So I want you to think about whole person impairment as being a reflection of the activities of daily living loss. So what is the functional loss rating? The functional loss rating, for the first time, is an actual method that uses direct functional loss rating to create the whole person impairment. And why it's exciting is because in a standard rating in the AMA guides, you look up a table, you look up a chart, you get a single value. For example, let's say you had your knee operated on and a meniscus surgery. They took out a small piece of the cartilage, and you're going to get 1% whole person impairment for that. So the problem is that you get 1%, whether you have any functional loss or not. And that is a common theme and problem throughout the AMA guides. However, if you're using the functional loss rating method, the history is really going to focus on what the patient can and can't do. So all 34 activities of daily living will be inventory, and you get a much clearer picture of what that patient can and can't do because of their knee. Maybe they can't stand, walk, sleep, they can't drive a car, have difficulties getting dressed, bathing, etc. But you have 34 options to discuss with the patient and better understand how this injury has really manifested itself and plays out in the patient's actual life. Whereas if you're just looking at the whole person impairment, reading it off a chart, that patient may be doing much better or much worse than the book would suggest. And this is one of the common themes that we come up against in the workers' comp system, is that when you use a fixed table or a chart, there's always going to be argument and disagreement about the accuracy, and appropriately so, because the chart may or may not capture the individual's actual loss. And by looking at the AMA guides, the activities of daily living, when we take that value, we can simply place it in a formula and we can put an upper and lower bound on it. We simply report the activities of daily living off that table, and we have a very specialized and concise impairment rating that's customized to the patient. And we're no longer bounded by being forced to have administrative impairment or an impairment value when there is no functional loss, or vice versa. So I want you to think about functional loss impairment rating with RateFast. Think about the concepts. Do not focus on whole person impairment. Do focus on activities of daily living. And I hope this has been helpful. And I hope you look forward to some of our other videos as we further explore the concepts and the impact that this new rating method will have in workers' compensation.